So, by the way, during the presentation, you'll see me looking over to my left. That's my screen with the presentation slides on it, so I'll be referring to that. So, obviously, the identification and management of sepsis continues to be a major challenge and has been a problem for decades. Sepsis is one of the highest cost disease states among all admissions to U.S. hospitals, probably the world, and we're going to go over that a little bit. The incidence is reported to be increasing by 8.7% a year, but the true incidence of sepsis and where we identify it and how we identify it is a little bit of controversy. There's a little bit of ranges. There's no solid number for that. If you look on the top left table there, this was a study basically looking at patients who presented to the emergency department into the ED. And you'll see that about 16% in both of these small studies, about 16% of these patients who present to the ED have serious infections. And overall, sepsis is about 8% of patients who present to the ED. And that seems about the right number. On the bottom long table, this gives us a more international flavor of sepsis, looking at studies from various countries, totaling over 14,000 patients. Again, the number of infections, serious infections, is about 10%. So if you couple this table with the previous table, the incidence of serious infections of patients coming to the EDs between 10 to 16%, and the number of sepsis positive patients in these three studies was about 4.5%. And you can see the studies range from about 4% to 11%. So overall, what you have to consider is of all the patients presenting to the emergency department, approximately 10 to 16% will have a serious infection. These 10 to 16% of patients are the ones you have to consider ruling sepsis in or out of. And out of these, all these patients that present to the emergency department, somewhere between 4 to 8%, 5 to 8% of patients will have sepsis identified through your ED. And that's an important number to remember, basically because we really don't know what the true incidence is. The table on the right, I think, is interesting because it's various studies from 2014 to 2020 that looked at over 250,000 patients. And what you see is that and these are 250,000 sepsis patients, positively identified sepsis patients. And out of these patients, 50% were admitted to the ICU on average. So let's get out of the mindset that every patient with sepsis goes to the ICU, because apparently that's not the case. And so about 50% will be on the floor, 50% will be in the ICU. But even with this, what you'll notice is with therapy, there's still about a 25 to 30% mortality rate with sepsis. So the incidence, 5 to 8% of all patients presenting to the ED, you need to rule it in, rule it out in about 10 to 15, 16% of patients. Now, obviously, the true incidence varies, and this is a worldwide problem. And I'm speaking to you from the US, and some of the stuff I'll be talking about is from US data, but this is a worldwide issue that we have to address in terms of sepsis. Now, I think the true incidence of sepsis may actually be underestimated rather than overestimated. The Centers for Disease Control have said, and the number that's frequently quoted in the US is 1.7 million adults have sepsis annually in the US. I think that number is low. And here's why I think that number is low. In 2020, Tim Buckman published a paper in Critical Care Medicine that looked at, it was the largest database of Medicare patients. In the US, Medicare pays 50% of all the healthcare costs of all insurance carriers. And in that study, he estimated that the incidence of sepsis was 1.1 million cases just in Medicare patients. So if Medicare pays 50% of the claims of all the money, for healthcare, and it covers 1.1 million patients, then it just does not make sense to me that we have a total sepsis case of 1.7 million cases in the U.S. Also in early 2020, Rudd looked at sepsis globally and estimated there are 49 million cases globally per year, and with 11 million deaths attributed to sepsis out of these 49 million cases. The interesting thing in that study was that she said with 11 million sepsis deaths, sepsis now exceeds annual global cancer deaths. So there were 11 million sepsis deaths annually globally. There were 9.4 million cancer deaths globally. So sepsis numbers now exceed that. But even with 49 million cases globally, it's hard to imagine that the US is only contributing 1.7 million of those. And then finally, Rhee in 2017 published a study that estimated 6% of hospitalizations were sepsis cases. Now go back to the previous slide where we said true sepsis in ED cases is somewhere between 5 to 6% of cases. That kind of fits right in that ballpark. But with 36 million, if we just look at the US, with 36 million hospitalizations per year, 6% of 36 million puts us at roughly 2.2 million cases of sepsis. So for those reasons, I think we're underestimating the true incidence of sepsis in these patients. This was another paper, part of that Rhee 2017 paper, and I think one of the reasons and one of the challenges we have with identifying the true incidence of sepsis is really based on how we define sepsis. And you have to be careful when you read the various studies as to how sepsis is defined. This is a study that looked at 5 years of several million sepsis cases, documented sepsis cases. And on the left, on the graph marked A, adjusted severe sepsis incidence, we see that the incidence of sepsis in 2014 in the far right column ranges from as low as about 2.5% all the way up to almost 12%. And that's purely based on the definition that's used. So this study used 3 different definitions in the same population and to get these different results. On the bottom, the explicit sepsis codes, these are using ICD-9 severe sepsis codes. There are 2 of them for billing purposes, and using those gives you the lowest incidence. And that's what a lot of papers use in identifying and reporting on sepsis patients. The middle one uses clinical criteria. This is clinician review of an electronic health record for presumed severe infection with ongoing organ dysfunction. And if you include the clinical criteria, that top line, that puts us right about 6%, a little bit over 6%. Very consistent with what we've already previously identified in the previous slides. And then the top graph uses what's called an implicit or explicit sepsis codes. This is called the Angus method and was proposed and published by Derek Angus, where he used the ICD-9 codes for sepsis, the 2 bottom codes, the explicit sepsis codes, the 2 codes for sepsis, plus adding on ICD-9 codes for organ dysfunction. And by using that definition, that gives you the highest incidence of sepsis consistently going up to 12%. So the definition varies, the incidence varies based on the definition that's used. And as you read various studies on sepsis, you need to be aware as to what definition and how they're really defining it, because it could vary significantly. On the right-hand side of this slide is the graph with the same patient population, but now looking at mortality. And again, the mortality rate based on 2014 ranges from 10 to 25%. So there's a 2.5-fold variability in the reported mortality rate of sepsis based on the definition that's used to how to define it. What about the cost? How much does it cost to care for these patients? We said it's one of the most costly disease states. The top slide is when we used to, from older definitions of sepsis, where there were 3 broad ranges of sepsis, severe sepsis and septic shock. We'll go over these in a minute. But basically, you can see as the progression of sepsis disease increases, as the severity increases from sepsis to severe sepsis and septic shock, the mean number of hospital days goes up fourfold, from 4.5 to 16.5 days. The daily cost, mean daily hospital cost, almost triples from $1,800 to over $3,000. And the total cost per case goes up almost sixfold, from $8,000 to almost $51,000. But if we average all these out, the average cost of taking care of a sepsis patient is around $25,000 per case. This was also validated in 2018 by a study that looked at over 2.5 million cases of sepsis. They report the mean hospital length of stay at 10 days, split between 6 days in the ICU and about 4 days on the floor. And again, the mean cost per case was about $25,000 per case. So that seems to be about the ballpark of what we're looking at for all of the mean cases of sepsis. Reimbursement is another issue. And from the US, the reimbursement is really tied to appropriate documentation, where documentation of the disease state is really key. Accurate diagnosis and coding for sepsis is really important, but yet 72% of all the coding for sepsis is coded as unspecified sepsis. And in 2011, the average government CMS, Centers for Medicare Services, which is the largest payer, the government pays, so when I say CMS, that's the government payer. Depending on how you coded the disease being submitted, a lot of times sepsis gets coded as pneumonia, either gram-positive or gram-negative pneumonia. Well, with gram-positive pneumonia, the average reimbursement was $10,000. With gram-negative pneumonia, the average reimbursement was about $14,000. But if you had accurately coded it as sepsis, the average reimbursement is $44,000. So not only is it costly from one end, but reimbursement varies based on how the coding is done for sepsis. So let's shift gears and talk about the timeline of how sepsis has evolved over the past several decades. And what you need to keep in mind are two broad categories. The